session of the anatomy and physiology of the cardiovascular system. Before we start today's session, let us start with the Dhanvantari prayer. Om Namami Dhanvantarim Adidevam Sura Surai Vandita Pada Padmam Loke Jararubhaya Mrityunasham Dataramisha Vividoshani. Okay, welcome back. So in the first two sessions, we had seen the details on the basic anatomy of the structure of the heart, the various arteries and the veins going in and coming out of the heart. So how the blood flow actually happens, all of that under the basic physiology, the cardiac sounds, all of that we had seen up to the last session. So today we will be dealing with the pulmonary circulation. So we had seen four pulmonary veins entering the left atrium of the heart that is carrying the oxygenated blood, right? And we had the pulmonary artery that was taking the deoxygenated blood, partially deoxygenated blood from the right ventricle to each of the lungs. So until there we had seen. So now what is the journey of the blood, or what is the journey of the of these pulmonary artery? What happens to them once they go into each of the lung, and what happens inside the lung? All that we'll be seeing today, which is very important. It is very important even in purview of the cardiovascular system and also in purview of the respiratory system also. So today the main topic of discussion will be discussing pulmonary circulation. Okay. So suppose we start drawing the basic structure. Okay, so we have the right ventricle, the left ventricle, so now we have the valves, so we have the valves, the semilunar valves and the mitral and the tricuspid valve. So now our focus of interest here today is about the pulmonary artery that quickly branches off into two. So suppose we are drawing both the lungs. So now we have the right pulmonary artery, the branch, that is the right branch of the pulmonary artery that is moving into the right lung. And then suppose this is the, just to brush up, so in the last session we had seen that from the right ventricle we have the pulmonary artery arising and it quickly divides into two, and we had stopped that, each of which the branch will enter into the lungs for further pulmonary circulation. So today, as a continuation from that, we are not drawing any other structures because we are mainly concerned with respect to this, the pulmonary circulation. The lung pump we are considered more of it, so that is why we are focusing on this. So here, apart from that, otherwise we had seen the aorta moving from here, that will be carrying the oxygenated blood, and we have the pulmonary vein that is coming back. So suppose we so here we have the entry for pulmonary vein. So let us see finally how it enters. So here we had entering the left atrium. So here what happens? Now once the pulmonary artery branches into two, that is the right branch and the left branch. Now the right branch immediately once it enters into the lung, okay, it divides again into other branches. Okay, so this is we are seeing at the very gross level. So there is actually how many branches it divides according to how many lobes and segment, all that is there which we'll be seeing. Before we going into the further next understanding of the same physiology, first in the gross level, what happens if we have an idea of that, we can understand the next deeper level better. So once the pulmonary artery moves into the lung, the branch of it, it divides into two. Now, once and again, not just into two, it divides and further again. Okay, there will be many capillaries. They'll further divide into arteriole, from which around the pulmonary capillaries, the gaseous exchange will take place. From there will start the venule, and from the venule, there will be again. So this. Okay, so it's better if we color it. So this is the pulmonary artery. So it comes, it divides. Next, there will be smaller division up to the capillary level. And from the capillary level, now there is exchange of gaseous exchange of blood. Next is the venule, where that will be carrying oxygenated blood. So this is a very gross diagram. Until two pulmonary veins, after gaseous exchange take place, further from the venule, there will be continuation of the veins that will be carrying oxygenated blood back to the heart. So this is just a gross diagram to symbolize the same. We will see in step by step how it actually happens after we understand this. Okay. So we have the two pulmonary veins. Suppose we consider grossly like this. So we have the two pulmonary vein coming and draining into the left atrium. So from the right side, right? Now the same thing also happens on the left side also. So this will come, break into several branches. So then there will be capillary exchange, from which so now, as we had seen in the last, we had seen that there will be four pulmonary veins that will be draining into the left atrium. So this is a gross depiction of how it happens. So we have the pulmonary artery that is coming up from the right ventricle. So quickly it branches off into two. It gives two branches. We had seen that in the last session. So one is the right and next is the left pulmonary artery. The right pulmonary artery goes into the right lung. So once it enters the lung, it will divide again into further divisions. There will be multiple divisions up to the smallest level of the the arterial level. And next, after the arterial level, we know that here at the junction, as it happens everywhere in the body, so that is, it breaks down into pulmonary capillary level, from which the venule will continue again. So the venule will further form into larger and larger veins until two great pulmonary veins, that is the two larger pulmonary veins of the right side, leave the lung out. So here the gaseous exchange takes place and the venule will carry the oxygenated blood. So we have one and we have two, which finally the two right pulmonary veins. Same thing happens on the left side also. So the two left pulmonary veins, we have two from the right and two from the left joining, forming the four pulmonary veins that will drain oxygenated blood into the left atrium. So from here we know how the blood travels, right? So from the left atrium, when the pressure increases and it contracts, it comes to the left ventricle. Again, when left ventricle going into the systemic circulation, that is the body pump, that is the oxygenated blood will get traveled to other tissues of the body. So this is the gross representation. Now once we are clear with this, we will now move into the details of pulmonary circulation. So the main thing to remember is the pulmonary artery exiting the heart, giving two branches, and then the two branches entering the lungs, and we have two pulmonary veins coming from the right and two pulmonary veins coming from the left lung, which will enter, all the four of them will enter the left atrium. Now moving further into okay. Now we will start looking into the details. So this is what we have one. So this is nothing but the main pulmonary trunk. So one is this is the same trunk that is coming from the right ventricle. We have excluded the other part of the anatomy so that we can draw it more clearly. Okay. So this is the main trunk, main pulmonary trunk. Then this is 2 and this is 3. So 2 is the right pulmonary artery and 3 is the left pulmonary artery. Okay. So it's very obvious that this is the right lung and this is the left lung. So now, the right and the left pulmonary artery are now going to enter the lung. If we see it closely, we can see that there is a small indentation like structure here, a depression like structure here in the medial surface of the lung. So what is towards the body, towards the midline is medial, away is lateral. So this is the medial surface of the lung on both the sides. Okay. So this depression like area in the medial surface of the lung is called as the hilum. So what is hilum very structurally important is that it is that through this hilum that the bronchial passages, okay, the bronchial passages, the lymphatics and also the arterial supply, okay, they enter and leave the lung. So it is through this that the bronchial passage, the arterial supply and the lymphatics move inside and come outside. So this region is called as the hilum. So here we are focusing now on the arterial supply. So how it happens. So with this with this pulmonary circulation, it is important that how we will be learning the anatomy and physiology together. So as and when we proceed, we will see what the pulmonary artery, how it breaks down. So what is the arterial supply, and then what is the venous supply that will drain back the oxygenated blood, with which we will get to know the anatomy, and we'll also get to know the physiology, what that particular anatomy is doing. Okay. So now this enters the right lung. Okay. Now as it enters the right lung, the right pulmonary artery will divide into three. Okay. So this will divide into three. Now why is it dividing into three? Simply because the right lung has three lobes. So suppose we are separating the lobes of the lung, the upper lobe, the middle lobe, and the lower lobe. So we have the right lung. So now this part of this part until here, it is the so this is nothing but the part of the right right pulmonary artery that has entered the right lung. So this part is in between the lungs. So this part of the artery, now the next, what does the right pulmonary artery next branch into? That next branch 4 is called as the interlobar artery. Okay, why inter? Because it is between the lobes. It is not yet entered the lobes for it to be called as intra. So it is inter, and it is between the lobes. So that is why it is called as the interlobar artery. So the next branch or the continuation of the right pulmonary artery after it enters the lung, it is the interlobar artery. I hope that is clear. Now we have seen that there is some part of the interlobar artery is now dividing into three, and it is entering each lobe of the lung. Okay. So now this is called as this becomes 5. So it is going into the lobes. So this is called as lobar artery. Okay. The main pulmonary trunk, right pulmonary artery, interlobar artery, and now comes the lobar artery, that is the 5th. Now, what will this lobar artery next do? Okay. Now, the upper lobar artery, okay, it breaks into 3 segments. The middle breaks into 2 segments, and the lower breaks into 5 segments. So, as is depicted here, 5 segments, 2 segments, and 3 segments. Okay, this is with respect to the anatomy of the lung. So both the lungs have 10 segments. So in the left side, if you take, now before going on further, we'll complete the diagram on the left side here. So in the left also, the pulmonary artery enters the lung, and here it divides into 2. Why? Because the left lobe, the left lung has 2 lobes. That is why it will branch to it will give only 2. So until here now we have the interlobar artery. Okay, and further continuation now, these are our so this is nothing but the left lobar artery. Okay, so now coming back into the segments. So here we have 5, 6, 7, 8, 9, 10, 10 segments in the right lung. On the left lung we have 5 segments each on the upper and the lower lobe. Okay, so the further continuation we will see on one side, and the left side it will follow the same pattern. So here this is with respect to the segments of the lung. As I said, the upper lobe has 3 segments, middle 2 and lower 5. So we will see what happens with respect to the segments. Now whatever we see in one lobe, the same thing is in the middle lobe, the same thing is in the lower lobe, same here in the left upper and same here in the left lower lobe. So we will see with respect to the this thing. So now we have the lobar artery. Now see, considering that it will give 3 segments, right? So now it has given 3 segments. So now we color this with okay. So now it is 3. So now we were done with 5. So this is 6. So what can this be called? This was with the within the lobe cells. That is why it is called as the lobar artery. Now this is giving branch to individual segments. So this is called as the segmental artery. So the further continuation of lobar artery is called as the segmental artery. Why? Because these artery will be providing, or it will be giving blood to the segment level. So that is why they are called as the segmental artery. Now moving further, what the segmental artery will do. Okay. Now further again, these segmental artery will further break down okay, I leave it like this so that it remains ideal. So these are called as, this is further down. So suppose we make it down. So this is number 7. So from the segmental, now we are having another branch. So this is called as, this is next to segmental. So it is called as subsegmental. So number 7 is subsegmental artery. Okay. Now after the subsegmental artery, so these vessels will be this after subsegmental. Further again there will be division of vessels. Okay. Subsegmental artery, there is further division of the subsegmental artery. What is further continuing deeper inside are the pulmonary lobules. Now what a pulmonary lobule is, that we will see in the next stage. But as of now what we have to see is that the subsegmental artery will further break down into many other minute structures, and these minute structures will now start supplying the lobules of the lung. Okay, they are the lung lobules. Okay, so they will be entering into the lung lobules. What is that pulmonary lobule? We will see it later. So these are called as the intralobular artery. So they will So that will be going into the lobules of the lung. So what does that have? It has the alveoli, it has the respiratory bronchiole, it has the alveolar air sac, all that are minute structures. So until that level, this intralobular artery will go. So for now, in the gross, what happens to this intralobular artery further until it reaches the air sac? That minute level, we will see it again with another diagram. So for now, we are seeing these many branches or divisions of the main pulmonary trunk. So what are they? So first we have the main pulmonary trunk, which is dividing into the right pulmonary artery and the left pulmonary artery. This right pulmonary artery will enter the lung through the hilum, and it will enter for certain distance, and then it will divide into 3 branches. Why 3 branches? Because the right lung has 3 lobes. So after it enters, that part is called as 4, that is the interlobar artery. Then that which supplies to the individual lobe, that part is called as the lobar artery. The lobar artery will again divide into 3 segments in the upper part, 2 segments in the middle part, 5 segments in the lower part on the right side. It will divide into 5 segments in the upper lobe and 5 segments in the lower lobe on the left side, that is the left lung. So since it supplies the segment, it is called as the segmental artery. The segmental artery will again further divide, and that is called as subsegmental artery. These subsegmental arteries will further again divide into smaller arterial structures, and they are called as the intralobular artery, because that will be supplying the individual pulmonary lobules or the lung lobules. That happens at the micro level. Okay, so this happens on the right side. So once further in continuation of what happens, so from the intralobular artery, so that again we will have minute pulmonary arterioles. From the arterioles, we have pulmonary capillaries. At the capillary level, gaseous exchange will take place, and from that will start again the venules, and from the venules you will have all the venules collecting together and forming a bigger, that is a single larger venule, and that venule will come back in the same pattern. So for now we have seen how the arterial supply happens. So all of this is happening through the pulmonary artery. So these are the branches of pulmonary artery. So now we will see how the venous drainage happens with the same diagram. So now, as I told you, from reverse process, so there is capillary exchange, and we have a pulmonary venule that is coming out of the lobule. So from this you have an arteriole, right? Suppose this is the lobule, we have an arteriole that is entering and a venule that is coming out. Now, that is the process, right? So that venule part is now draining out. So from the pulmonary venule, so the first, how the venous drainage happens, we will see here. So first is the pulmonary venule that is leaving the lung lobule. Okay, that pulmonary lobule will drain to the interlobular vein. So one difference what we can see is that here it was the intralobular artery. That is because it is moving completely inside the lobe, that is the pulmonary lobule. But when the venous drainage happens, the further continuation of the pulmonary venule, it will happen between the lobes and not within inside the lobe. That is why here the name becomes interlobular vein. Okay, so from the interlobular vein, where will it go? From the interlobular. So 8 was interlobular vein, right? The same pattern the venous drainage will also form. So we are coming in the reverse now. So from the microscopic, we have the pulmonary venule that is draining to the interlobular vein. So from the interlobular vein, it will drain to what? These are called as subsegmental. So that will drain back to subsegmental vein. That will again drain back to segmental vein. So these are segmental vein. That will again drain back to the lobar vein. Okay, the lobar vein will join together to form the two main pulmonary veins. So the pulmonary veins, two large veins, they will come back and move into the left atrium. So this is the arterial supply and the venous drainage. So arterial supply we have seen twice, starting from the main pulmonary artery to the level of the intralobular artery, and now we were seeing back the venous drainage from the capillary gaseous exchange. So there will be a pulmonary venule that will drain into the interlobular vein. Why it is called inter? Because the vein, when it is draining back, it will move between the lobes and not within the lobe. That's why it gets the name inter and not intra, unlike here. Okay, so from the interlobular vein, it will follow the same arterial pathway. So we have the subsegmental vein. From subsegmental vein, we have the segmental vein, and then we have the lobar vein. From the lobar vein, so the lobar vein will conjoin to form the two big pulmonary veins that will drain from the right lung into the left atria of the heart. I hope now at the gross level, at the superficial level, up to the intralobular artery, the circulation is clear. Okay. Now we, in the next part, we will now further move into the microcirculation, that is from intralobular artery, what happens next. So here we just saw it in the gross level that there will be capillary exchange, everything, right? So what actually happens, that we will see in the next slide. So we will be seeing about the pulmonary lobule. So now we will be seeing the pulmonary lobule. Okay, so it is also called otherwise as pulmonary microcirculation and gases exchange process. Okay, so we will see what happens. So now we are further looking into the blood supply at the microscopic level, further down through the intralobular artery where we had ended, right? Now, interlobular artery, after about 20 to 25 divisions, okay? After the about 20 to 25 divisions of the intralobular artery, further it will go down, and the next stage what we see are called as the small air passages, or it is called as small bronchial passages. Okay, so these bronchial passages, which is what called as the respiratory bronchiole, what is that we will see. So further down from the intralobular artery, we are seeing further down. So here we have, what we said was, we have small air passages, or it is called as the bronchioles. Okay, bronchial passages. Now, whether this bronchial passages is straight like this, no, the bronchial passages has certain projection like structures on its surfaces. Okay, why projection like structures? Because these will increase the surface area for the gaseous exchange. So these projection like surfaces are nothing but, so this is one, It is nothing but the alveolus. In group, the plural, it is called as alveoli. Together when it is put into. Okay. So this is the alveoli. So we have the bronchial passage. This bronchial passage, okay, consisting of the alveoli, it is called as the respiratory bronchiole. Respiratory bronchioles. Okay. So at this level, where we have the air passage, that is the air bronchial passage, along with the alveoli, this entire structure is called as the respiratory bronchiole. Okay. So it is the respiratory bronchiole that is the first place where the surface area is also increased, and it is also the first place where the gaseous exchange takes place. Now, further what happens is that the respiratory bronchiole will further break down into smaller respiratory bronchioles or smaller air passages. Okay. So now we have the respiratory bronchiole that is dividing into further down into smaller air passages. Okay. So now these are called as alveolar ducts. Okay, these are called as alveolar ducts. Now, where will these ducts go into? Now, these ducts will go into the air sacs, the classical structure of alveolar sacs. So, we have the respiratory bronchiole. So, this entire part is called as the respiratory bronchiole. From the distal end, we have the alveolar ducts coming up, and these alveolar ducts will end into the air sacs called as the alveolar sacs or alveolar air sacs. So these are three. So these are the alveolar air sacs. So again here it is increasing the surface area for the gaseous exchange and for the especially for the gaseous exchange, so that there is exchange of the O2 and the CO2. Main what is to be drained out is the oxygenated blood. Okay. So now what we have to see here is that now these units are called as the pulmonary lobules. Okay. So this entire unit is called as the pulmonary lobule. Now, we saw that the intralobular artery enters the lobule, right? That is why it is called as intralobular. So, the pulmonary lobule is nothing but this, which is consisting of the respiratory bronchiole, the alveolar duct, and the sac. Now, each of these lobule will be surrounded by a connective elastic tissue. Okay. So, when it blows ups and down, it helps in squeezing and then exchange of the gases and for the expulsion of air. So each of these pulmonary lobules is covered by a elastic connective tissue. Okay, so this is okay. So from here downwards, now this is what is called as the pulmonary lobule. So what we have to see is that sprouting from each of the respiratory bronchiole, we could have 2 to 11 alveolar ducts. So it could be 2 to 11. From each of the respiratory bronchiole, around 2 to 11 alveolar ducts will sprout, and then we'll have so many alveolar sacs. Okay. Now next, what is that we are going to see? So this is the structure we have seen, and lastly we had stopped with the interlobular artery, right? So here what happens now? So So continuation of the intralobular artery, sorry. So now it will follow the air passage as such. Okay. And it will divide into 3 or how many ever alveolar ducts are present. Okay. So now once it divides further, it divides into arterioles, okay, capillaries, the pulmonary arterial capillaries, okay, from where we have the pulmonary. So from the capillary exchange, there is gaseous exchange that is happening, from which we have the pulmonary venule that will be coming out. So each of these venules will join okay. So each of these venules will join to form a pulmonary, the main pulmonary venule. Okay. So the arteriole is entering and the venule is leaving out the pulmonary lobule. So we saw that now the arterial supply is coming down. It is breaking down through the alveolar ducts. Okay. So the pulmonary capillaries will branch off again near the alveolar air sacs. Now, when it breaks down near the alveolar air sacs, here gaseous exchange takes place, and from there the venules will further connect. Okay, this venules of the each air sac will connect, okay, to form a main pulmonary venule of that pulmonary lobule. So that is why, and it is moving out of the pulmonary lobule as what? It will move out as the interlobar vein. So we had seen previously that it will move out as interlobar vein. So from interlobar vein, it will again follow the same channel of the subsegmental, the segmental, the lobar vein, and from the lobar vein, it will join to form the pulmonary vein of that particular cell. So again, we'll see. So we have, this is the continuation from the intralobular artery, what we had seen at the micro level. So these are the respiratory bronchiole and the pulmonary lobule and its anatomy. Now the intralobular artery that is entering will follow the same air passage. It will divide through the alveolar ducts, and once it reaches the air sac, it will split up to capillaries where gaseous exchange takes place. So the individual venules of each and every lobe, okay, each and every air sac, sorry, will join to form one main pulmonary venule that will leave out of the pulmonary lobule. So this will further again continue to the so this is the interlobar pulmonary venule. So the pulmonary venule will further move into the interlobar vein to subsegmental, next to segmental, and then we have the it will join to form the lobar vein. It will drain to the lobar vein. From the lobar vein, we have the two main branches of the pulmonary vein, two from the right and two from the left, all of four which will come and drain into the left atrium. Now, along with this, here we also have the lymphatic drainage also, okay, that will represent in green. Okay, so this is the lymphatic drainage or the lymphatic capillaries. So we have many lymphatic capillaries that is draining out to the lymphatic vessel. So to me, so this is 5, this is 6. So 5 is pulmonary arteriole, 6 is pulmonary venule, and 7 is, so this is 7, is the lymphatic vessel. So this is with respect to the pulmonary lobule. So with this, today we have seen the arterial supply and the venous drainage starting from the main pulmonary trunk from the right ventricle. So from there we saw what are the branches, how the arterial branches happen up to the intralobular artery, from which down there is microcirculation. We saw how the microcirculation happens. We saw the anatomy of the pulmonary lobule, why it is called as intralobular. So what the respiratory bronchiole consists of and what the pulmonary lobule consists of. Then we saw the microcirculation starting from the pulmonary arteriole to moving out of the pulmonary venule. So with this, we will conclude today's session, and in the next session, we will be moving further with the further anatomy and the physiology of the cardiovascular system. Thank you. Om Namami Dhanvantarim Adidevam Surasurairvanditapadapatmam Loke Jararubhayamrityunasham Dataramisham Vividaushadhina. Om Shanti Shanti Shanti. Thank you.